Good morning, guys. It's been reported by Surgery 411 about 12 hours ago that Spice is back in the US, that she is reportedly looking frail, but she is walking. She was air vac out of the Dominican Republic back into the US in Florida for better treatment. It's reported that she is in Fort Lauderdale, Florida, and she was medevaced to a private airstrip last night, and she has a stoma, allegedly. This is according to Surgery 411. Well, what is a stoma? And I'm about to tell you guys what a stoma is. So according to Wikipedia, a stoma is an opening in the body, for example, like your mouth, your nose, your anus, or natural stomas. Any hollow organ can be manipulated into an artificial stoma. So the word stoma is a big time word for an opening. So the report said she has a stoma in her abdomen, her stomach area. That means because the bowels have been damaged by being punctured, the intestine was damaged. So in order for it to heal now, they had to make an artificial opening. And with that artificial opening, she's going to have to wear a colostomy bag. That's what allegedly usually happens. That's usually the procedure. I don't know exactly what it did with Spice because I'm not getting it first hand information and I'm not there to see her abdomen. But that's usually the protocol. They open up, they put a hole in the belly area and bring out the intestine that is not perforated on the upper level, but they bring that intestine out and they suture it around the abdomen, and the feces will come out of that and it drops into a bag, similar like what Gollibop have, a feces bag. And that allow the damaged part of the intestine now to heal because no feces is coming out of that area, no gastric juices, none of that. So it will heal. So her intestinal perforation can heal. Doctors say she might not be the same. Of course, when you have a perforated intestine and they have to repair it, and if you go jumping off speakers, you can open up the incision. So Spice has to be careful with what she does. Although you're healed, for instance, and this is just an example, when you get healed and you go jumping off speakers and landing on your stomach and all kinds of things that is extraordinary, you can actually reopen that heel incision because it's not the same as when it was originally. It's not the same. Moving forward, and I believe that Spice is going to make some changes, allegedly. And of course, she's still going to be performing because, after all, she's Spice. But she's not going to be doing all the jumping that she used to do, which, she has to take care of her health, and I'm sure she's going to. And once that area of the bowel that have been perforated heals, then the doctors can remove the stoma bag. Now, like I said before, I don't know if that's the protocol that they did with Spice, if she has to carry around a feces bag for a little while until the bowels heal. But I know of someone who had a perforated bowels, and that was the protocol for them. They accidentally puncture the bowels doing surgery. The person was going through surgery and the doctors actually accidentally punctured it, and the person had to use a feces bag until the bowels healed up. So I don't know the protocol if this is what they're going to do for Spice. So this is all alleged, folks. I also look up perforated bowels on Google, and this is what they have to say about it. They said perforation of the intestine or other organs cause the content to be leaked into the abdomen. And this causes a severe infection called peritonitis. And the symptoms include severe abdominal pain. So the bowels is a closed system, like the blood vessels where the blood travels in, that's a closed system. Nothing that is infectious can enter the blood. The feces is a closed system. All the feces that's coming out of your body that's in that intestine, it's a closed system. It does not escape and go anyplace else. But once it escapes and it goes and it leaks into the surrounding tissue, it's very, very dangerous. So the surrounding tissue is what they call the mucosa. And once it leaks into the mucosa, the surrounding tissue of the bowel wall, it causes a massive infection. And then it gets into the bloodstream and it leads to sepsis. That means you have inflammation in your blood. It's going to shut down your system. All your organs might go into failure if it's not treated promptly, and you can die. And we hear of cases where people die of sepsis all the time due to not necessarily perforation of the bowels, but bacteria getting into their blood system by another way. So according to WebMD, the way they treat this perforated bowels, everything that has leaked into the surrounding tissue, they have to get it out. So they put in this drainage, like a little plastic tube that is attached to the inside of your abdomen in the area in which they need to drain out all this stuff. They may flood the area with antibiotics to get rid of some of that bacteria. And then they put in this drainage tube. And of course, IV antibiotics, intravenous antibiotics. So it's a whole process to get you back and in good medical condition. So the information on WebMD further goes on to say the usual length of stay in the hospital is 7 days, 5 to 7 days, but your doctor can keep you longer if there are complications. But if there's no further complications, soon after surgery, you're going to be encouraged to walk. And the walking helps you heal faster, believe it or not. The more walking, and so you're helped with the walking. There are people there to assist you in walking so that your body can recover faster. So it's just gentle walking. It's nothing strenuous. And it also helps with the digestive function. Because if you don't walk and you're just laying up in bed, your digestive system, your bowels is going to fail to work. All that peristalsis, how the food moves along the colon, is going to stop. And then you're going to really be in trouble and you're going to be impacted. Walking also helps your heart and the lungs and can help clots from forming in your legs. So, folks, this is a process. When you have a perforated bowel and the doctors are trying to heal that portion that they damaged or whatever damaged it, it's a process to get you back up to speed. But it's life. You just got to work with whatever comes your way. And for Spice, this hit her. It was unexpected. And so she just got to deal with it, work through the process into healing. I don't know what exactly she had done to her and what they're doing in terms of getting her back into the healing process. So this is all alleged. I'm just putting information out there just for GP, just for folks to know what goes on when a person have a perforated bowels. And I don't know the latest technique, but I know this is what the protocol is and was, but I don't know if there's any new technique into taking care of a perforated bowels. So there might be something new on the market that they're using where they don't have to use a stoma bag. I don't know. So it's also been reported that she had several surgeries, not just lipo in the tummy area, but she had several. Now, it's not clear how many surgeries she's had and where exactly these surgeries took place on the body, but we just know about the perforated bowel. So again, these statements are alleged. And guys, you know about when your bowels is perforated, all that feces is poisonous. That's why it comes out, okay? It can't stay in the body because the waste material that we look at as feces is poisonous to the body. So the body gets rid of it. So when the bowel is punctured, all that feces gets spilled and it gets absorbed into the tissue, surrounding tissue, it gets absorbed into the blood system, and you have the lymphocytes, or little soldiers that fight to keep us healthy. It's part of the immune system, the lymphocytes. And they get out there and they try to kill all this bacteria that is now flooding your body because the feces is full of bacteria. And so when they get all in your surrounding tissue from the puncture site, and then they go all over the body to the bloodstream, then these little soldiers that we have start fighting to go to war against the bacteria. So the above picture shows the lymphocytes in the bloodstream chasing bacteria, surrounding the bacteria, engulfing it, and killing it. And so that generates pus in our bodies. And we get a fever. We got to get antibiotics to get rid of all the inflammation and the infection. And if the infection is like, let's say, a cut on your hand or a cut on your foot, and it's infected and you see that white pus, that's the bacteria and the lymphocytes. That's the result, the pus. So getting back to what sepsis is and what these lymphocytes do, and they start killing bacteria and causing pus and inflammation. And the person comes down with this systemic infection. That's what this sepsis is. It's a systemic infection in the body. I'm going to read the definition on the internet. According to Google, sepsis is a life-threatening complication of an infection. Sepsis occurs when chemicals released in the bloodstream to fight an infection triggers inflammation throughout the body. This can cause a cascade of changes that damage multiple organ systems, leading them to fail, sometimes even resulting in death. So guys, even if the doctor did not damage any other organs, the sepsis alone can damage the organs. The inflammation that's in the bloodstream can damage organs. So it is a very, very serious condition that can result in death. So I guess this is why reports were coming out of the DR that she had multiple organ failure. Not because the doctor maybe did something to the other organs, but because the sepsis was killing the other organs. So Spice's team has yet to say exactly what happened in terms of the complications that resulted in the bowel perforation. So until we get a real true picture of what happened coming out of her camp or from her mouth, this is all alleged. But we're happy to hear that Spice is alive and well. That's the main thing. And she is alert. And of course, being medevac to Florida, Fort Lauderdale Hospital, she's going to have better care. So I'm glad that they were able to get her out of the DR and back to the US. Allegedly. YouTubers, keep your ears to the ground. I'm over and out. Thank you for watching.